Hello, everyone. Welcome to another edition of Chat with a Professional, a monthly oral health education series by Oral Health Africa Initiative. Chat with a Professional serves as a platform where oral health professionals and the public can engage in practical, relatable, and evidence-based conversation on important oral health topics. This month, we'll be looking at a very important topic: oral cancer, common causes, and preventive measures. Joining us today is Daniel Adewale Goodness, an oral health advocate, speaker, researcher, and emerging dental professional with strong passion for preventive oral health care and community impact. He completed his Bachelor of Dental Surgery training at the University of Medical Sciences, where he distinguished himself through leadership, research, and service. He has received specialized training in implant dentistry and has demonstrated a strong interest in advancing oral health education. And most recently, he served as a keynote speaker at the 3rd European Conference on Dentistry and Oral Health in Barcelona, Spain, where he virtually presented on the future of personalized and preventive oral health care. Beyond academia and clinical practice, Daniel is actively involved in oral health advocacy and community outreach, working to improve oral health awareness and access across underserved populations. Dr. Daniel, it's a pleasure to have you with us today. How are you doing today?
I'm fine, ma'am. I'm fine.
Thank you so much for joining us today.
Yes, ma'am.
So, set the stage for our audience. Let's begin with the basics. What exactly is oral cancer? People know of all types of cancer, but oral cancer is not exactly in public knowledge. So what exactly is oral cancer?
Okay, I will try as much as possible not to say so many medical jargons. I'll try to be simple as possible. So,
please don't.
Oral cancer is an uncontrolled growth of abnormal cells in the mouth or throat that can invade and destroy surrounding tissue. I think that's as simple as it can be. When you begin to have an uncontrolled growth of abnormal cells around the oral region, which is the mouth, the throat, even extending to the neck, we can say that this person has oral cancer.
So abnormal growth around the oral region. What does this growth look like? And you saying when we have like swelling, irregular boil, should we be afraid that this is oral cancer in sight, or what kinds of growth and what do they look like really?
I would firstly like to also mention some common areas to also look out for, because some very common areas that are also affected in the oral cavity. Then I'll also explain things that should give you concern when you see them. Number one, the areas that are commonly affected, we have the tongue most especially for cancers like squamous cell carcinoma. We have lip, we have the cheek, we have the floor of the mouth, we have the palate, and we have gingiva, commonly known as the gum. The things that you should look for is, I would say, non-healing mouth ulcer, but let me say something like non-healing mouth injury that lasts more than 2 weeks. When you have red or white patches inside your mouth, when you have unexplained swelling or lumps in the mouth or neck, then you have difficulty swallowing or chewing, you have persistent mouth pain or numbness, losing teeth without an obvious dental cause should call for concern.
Okay, thank you so much. If that's the case, oral cancer, what exactly causes it? These symptoms that you mentioned, is it something that just suddenly creeps up at people, or it is something that is gradually experienced over time?
I would like to say that, number one, cancer is a multifactorial cause. There are so many things. I would like to deal with more of the risk factors than dealing with the cause, because there's so many things that can cause cancer. So I would like to deal with some of the common causes, or let me say risk factors that can lead to cancer. Number one, tobacco use. Both the smokeless tobacco and the smoking one. So the smoking and smokeless tobacco, very, very, very important. Inside that particular dangerous thing, there are so many carcinogenic agents that's inside this thing that can actually cause cancer, and it's one of the leading causes of cancer. As a matter of fact, tobacco use is number one, no argument there. Then alcohol has a multiplicative effect, especially when it's used with tobacco. Then we have HPV infection, which is the human papilloma virus, especially the HPV 16, especially watch out for that one. We also have excessive sun exposure when there is UV, ultraviolet ray, too much exposure. And then we also have genetic and age. For example, there can be an history from the family, so it can also be a cause. Then people, when they are at age, when we're talking about, we have the cancers that affect the extremes of age. We have the cancer that affects our aged people. and we have cancer that affect the middle age. These are the risk factor or causes of cancer. I hope I've been able to do justice to that question.
Oh, yes. Yes. You mentioned genetics. You're saying that if it is within the family history, a person is automatically prone or is at risk of having oral cancer?
It's not the issue of an automatic thing, it's a risk. You understand? If there's a family history of a particular cancer before, the patient is at risk.
At risk of also having such cells detected.
Yes, and that is why it's very important that, especially when there is a risk or something like that in your family, especially for those that are learning that know about it, it's important that they take note of their health, do everything to avoid a reoccurrence of that cancer in the family.
So our audience, you've heard this. Once you know that this is something that is reoccurrent in the family, within the family bloodline, please ensure to do everything possible within medical and dental power to stop and to manage this health concern. Quickly, we'll be going into warning signs. Our audience might be concerned now that I've heard all of this. What exactly should I look out for?
I think I've mentioned them earlier on, but repetition
yes,
is
you did.
very...
If you just expand on it more now.
For example, like I said, we have something we call non-healing mouth ulcer. We have an ulcer, which is like an injury in the mouth. For example, maybe you are feeling the kind of like, something as if when you have an injury, the way you feel like the pain, this in your mouth. And okay, we have something like aphthous ulcer, maybe that is caused by stress, that's caused by hormonal change, like that. But this kind of ulcer, it won't go. You understand? That one, the aphthous ulcer, after some while, maybe after you have used vitamin C, even if it's caused by viral, it can still go by. But this one, especially taking note of the 2 weeks that has lasted more than 2 weeks, you want to begin to be careful that you have an ulcer in your mouth, you have a feeling, a sore, a pain, an ulcer in your mouth for more than 2 weeks. You need to quickly go and visit your dental. Visit the dental clinic is very, very, very important. Anytime you see things like that, please, a non-healing ulcer for more than 2 weeks, please do go and visit the dental clinic. Number 2, I mentioned the red and white patches. We call the red patches, we call it erythroplakia, and we call the white leukoplakia. When you see white patches around your cheek, we call it the boca area. You see it around your tongue. You see it. Sometimes it can even be the mix of both. You can have the white patches surrounded by the red patches. You understand? Any of those signs, when you see them, they have potential to transform to malignant lesion. Potentially, this thing to transform to malignant. You want to be very careful. As much as possible, you want to make sure that you go and see your dentist. Another one is unexplained swelling or lump in the mouth or neck. So if you are noticing a swelling in your swellings, especially when it's not caused by a dental pain, which is all in your teeth, or it's not around you, begin to see swelling, especially large, fast-growing swelling or a slow-growing one. As long as you can notice swelling in your mouth, whether it's even caused by dental pain, just visit dental clinic, because even some of these can transform to other things like cysts and the rest. Please, when you see swelling in your mouth or in your neck region, your oral region, your neck region, please do well to visit your dentist. It's very, very important. You are seeing unexplained difficulty in swallowing, or you didn't have any trauma there, nothing, just over that there's a difficulty in swelling and chewing, please do well to also visit your dental clinic. Then discover that a persistent mouth pain or numbness, and you can't really pinpoint, there's no caries to pinpoint teeth, something like that, please do well to visit your dental clinic. Then last, like I explained, lose teeth without an obvious dental clinic. This one is very, immediately you see this, no trauma, no history of no history of caries, no presence of dull licking that looks like a periodontal pain. I know most people might not understand periodontal, but you see something that looks like that, it's just removed easily, just comes of your mouth, and you're wholesomely, if the old teeth came out wholesomely, and please make sure you visit the doctor. That's a warning sign. It means there's something up there or something down there that pushes the teeth out of its position.
What are like the misconceptions, the myth that people have about like oral cancer? We hear a lot of things. Oh, it is this, it is that. From your experience and from what you've heard so far in practice, what are the myths and misconceptions that people has talked about regarding oral cancer?
Let me start with the first one. As much as I expatiated and I spoke on the fact that one of the leading cause or risk factor for oral cancer is smoking. I want to also re-emphasize that oral cancers does not only one of the means is that oral cancers only affect smokers. And the fact is that non-smokers too, including young adults, can develop oral cancers, especially those that have
Wow. Oh,
yeah,
wow. Oh,
yeah,
wow.
yes. As much as smoking is a very important risk factor for it, we can have non-smokers, especially people that have the human papilloma virus. Another one I want to talk about is that young people cannot develop oral cancers. Age is not a guarantee of safety. As we understand that it commonly affects your age, we still want to assure that at any age, I think the awareness should go around all part of life, from children to adults. I think it's something that we can even add even to the children education, ability to know some of these little signs and be able to guess. Mommy, there's something that's been in my mouth for more than that's been paining me. Mommy, please, let's go to dental clinic to check it. Mommy, there's a swelling in my mouth, man. I think that should be also part of the awareness that should be taken to the schools, to the primary schools, the secondary schools. And that means is that any oral cancers are always fake. That's not true. The early oral cancers, especially the benign ones, they are always painless. And so benign is like the younger brother of what we call malignant. Like is by the time we get to malignant, we are calling it's all shades of trouble. Without saying yes, there's tendency for it to, when it becomes malignant, there's tendency for it to move from a particular region of the body to another region of the body. It can metastasize. That's the term we use. Oral cancer is usually painless, and this is why regular checkup matters. Don't wait for pain. Don't wait for pain. Don't wait for pain. When you see those swellings, when you see those ulcers, when you see those signs that has been mentioned earlier on, some of those signs that have been mentioned earlier on, make sure you get checked, because like I said, early screening and early detection is a key in secondary prevention of oral cancer.
Oh, you said a whole lot. We've heard so much about, these are the misconceptions, these are the warning signs, these are the causes. Yes. We've heard so much about that. How can this be prevented? As a regular person, what practical steps can our audience take to reduce their risk of developing oral cancer?
To this prevention, I would like to make it into classification. You understand? I would like to classify this prevention into primordial prevention, primary prevention, secondary prevention, and tertiary prevention. For the primordial prevention, that's a place of policy making. I think it's high time that there should still be more restriction on policies to avoid tobacco. I think a level of policies to either inflate their taxation so that there will be increase in the price, so that it's not be affordable to a common man, or there should be policies to restrict even the advertisement of tobacco in whatever area, and also alcohol. If those policies can be made into existence, I think it will also reduce part of the risk factors that we are battling with. Because no matter how much we have, if these things are still available to a common man, we are fighting a battle that is not ours. So I think number one, which is the part of the primordial, is policy making to ensure that some of these risk factors are taken away, to reduce the barest more. I know we can't eliminate them, but as much as possible, we still want to make a global or a country effort to make sure that these things are reduced to the minimum level. So on that, we now have the primary prevention, and that is where we want to raise oral health awareness. We want to raise at all cadre of life. We want to also raise the awareness of the human papilloma virus. We want to let them know why they should not do this, why they should avoid lip sun, why they should protect their lip from the sun, excessive sun, why they should eat well, why they should take care of their teeth, good oral hygiene. That's for the primary part of prevention. For the second part of prevention, and this is where early detection and early screening and early detection comes in, so that when these things are detected early, they can be, if there will be need for a quick surgery. You understand? There are so many surgeries that if detected early, quickly eliminated, quickly dealt with, they can quickly go through chemotherapy, radiotherapy, and ensure that it is stopped early, it's eliminated early, and it doesn't have to progress and also affect other regions or metastasize to other places. Then we have the tertiary place. That's tertiary, and that is after it has caused trouble. Now, so the rehabilitation after it has caused trouble. We want to ensure that even after the person, maybe for example, some people the cancer can affect them and they will have to do what we call maybe a mandibulectomy, a maxillectomy. So after that, they will need some restorative rehabilitation therapy to ensure that they go back to their normal lives. For example, the obturators like that. We have different cadres of prevention. For generally, the prevention strategies that I would like to put across is number individuals now. Avoid tobacco. Number two, limit your alcohol to the barest minimum, because like I mentioned the time, I said tobacco and alcohol, they have a multiplicative effect on this cancer of the thing. Ensure you eat healthy diet, eat plenty of fruits, vegetable. I know that it's becoming like a rhythm or a chorus to an anthem, but please, these things are true. Please do them. Eat healthy, eat well. Then, very importantly, make sure that if you are not vaccinated with human papilloma virus vaccine, please go and take it. Very, very important. Ensure that you start taking note of your lip protected. Very importantly, don't forget, keep good oral hygiene. Brush twice, use medium textured toothbrush, use fluoridated toothpaste. Make sure you visit your dentist every 6 months for checkup and for scaling and polishing. Thank you very much.
You absolutely did justice. And I'm sure some of our audience might actually be as surprised as I am with respect to the lip balm part, right? We all use lip balm to just keep our lips moisturized, but we do not know that we are also helping ourselves and in the long run preventing ourselves from oral cancer. Thank you so much for that. Thank you so much. Over time, we've said it so much. Oh, do this, take care of your teeth, brush twice daily, use fluoridated toothpaste. And it's funny how it is also a preventive measure for oral cancer. This is to our audience now. We can see that good oral hygiene is not necessarily for the aesthetics. In the long run, it is for the betterment of your oral health. And also, our guest has rightly mentioned visits to the dentist, because if you visit your dentist regularly, these things will be dictated early and treatment can start early on. That way, it can be properly managed. So we are wrapping up now. What's that one message you'd like our audience to remember about oral cancer? They just want to hold on to one thing. What is that one thing you would want our audience to hold on to from this session?
I would like to put that one thing, other 4 things. Just that, please, number 1, know that oral cancer is largely prevented by lifestyle choices. So you have seen the factor that is largely prevented by lifestyle choices. My number 1 advice is that start living right. Take choices that will not cause future consequences. Number 2, early detection of oral cancer reduces from 30% to 80% survival rate. Please ensure that you visit your dental clinic at least twice in a year. Do not ignore any persistent changes in your mouth that last for 2 weeks. Even whether it is swelling, whether it is ulcer, any mouth changes that lasts more than 2 weeks, please make sure you go and visit the nearest dental clinic and let them check you out, do a proper checkup, and let them tell you whatever. Let them either alleviate your fears or let you know your treatment plan or what next to do. Thank you very much.
Thank you so much for that. Lifestyle is very, very important. Visit to the dentist is also very, 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 very important. Thank you so much for sharing your knowledge and insights with us today. Today's conversation has basically just reminded us that oral cancer begins with education. Now we understand the risk factors, we can recognize early signs, and we know that we should seek professional care as soon as possible. And all of this play a role in protecting our oral health and overall health in general. Thank you so much for coming on this chat with us. It's been amazing talking to you about oral cancer, the risk factors, and the preventive measures. And to everyone watching, thank you so much for joining us for this episode of Chat with a Professional. If you found this conversation helpful, we encourage that you share with your friends, your family, your colleagues, and your community. Remember that awareness saves lives. We say a very big thank you for joining us. Until next time, stay informed, stay healthy, and keep smiling. Bye.